We have brought you medical stories in the past that you've told us changed your life. The story we bring back tonight is in that category. The subject is so delicate you rarely hear about it on television. We delved into it because it is a critical issue for so many couples. It's a sexual problem that dramatically affects the intimate life of a surprising number of men. What should be their most pleasurable moments become their most embarrassing. So now, for them and the women they love, Dr. Timothy Johnson has medical news that's already changing lives.
According to the American Psychiatric Association, the essential feature of premature ejaculation is that the man lacks adequate voluntary ejaculatory control, with the result that he climaxes involuntarily before he wishes to. Simply put, he is unable to control when he ejaculates. For premature ejaculators, the recognition that they've reached this point of no return comes too late.
If they're having orgasms quickly, they're missing the whole cake. They're having the icing, but they're missing the cake.
Eva Margolies is a New York sex therapist and author of Undressing the American Male.
Premature ejaculation generally presents itself by always having been there. Most men who have the problem have always had the problem.
Well, the good news is there is help for overcoming premature ejaculation. In fact, most of the experts we talked to said the condition can be treated quite easily if the person finds the right kind of help.
And what happens is that a woman stimulates her partner manually, arouses him to the point where he's fairly close to orgasm, stops stimulating, she lets the urge to ejaculate go away, re-stimulates him, and they do that stop-start technique a number of times and over a number of weeks. The next step, once he masters that, is vaginal desensitization, so that a man can become desensitized to what has often become an almost automatic response of penis near the vagina orgasm. The final stages involve penetration desensitization.
Now, as you describe this in these general terms, it sounds like you're asking a man to do what you said they shouldn't do, almost. That is, to think about this, to be preoccupied with it.
The first stage of learning anything new is to focus on what you're doing. So I'm sure when you learn to drive a car, or at least when I learned to drive a car, I focused on every little thing. After a while, what happens is that process becomes integrated. It becomes automatic.
But it still happens very quickly.
Yes, 1 or 2 strokes.
We showed Eva Margolies some of our interview with Ray.
The same problem occurs.
He went to a psychologist and a urologist, and they both sort of told him, just think of other things.
A lot of doctors tell their patients, think baseball, 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 which is exactly the opposite of what someone needs to do. And if you're not focused on what you're feeling in your body, you can't develop ejaculatory control.
I'm one of the few unfortunate that have the problem of premature ejaculation.
What if I told you that it's a very, very common problem among men? Would you be surprised?
Very surprised.
Well, actually, it is quite common. That's why we're doing this story, as a matter of fact. What if I also told you that the experts now say that this problem can be cured in the vast majority of cases?
They didn't count me in that treatment.
They didn't count you in?
No, I'm saying they didn't count me in on that treatment.
You'd like to consider some treatment?
Oh, yeah. Yes, I would like to.
After our interview, 2020 did arrange to send Ray to see Eva Margolies for treatment.